Hi, today I'd like to answer a very common and burning question that a lot of miscarriage patients have, and also I hope you take this advice seriously. So, the most common question that I receive from a patient consultation is that what to do after a miscarriage. And the number one thing that you must do after a miscarriage, regardless if it's your first miscarriage, second miscarriage, third miscarriage, is to not try for another pregnancy again. Regardless of what your doctor may say, you are risking your next pregnancy to potentially be another miscarriage again. When the frequency of miscarriage increases, it also complicates the underlying factor that's actually causing it. Initially, in your first miscarriage, second miscarriage, the underlying cause is actually quite simple in nature, easily treatable, and then you can actually don't have to complicate things, and you can have a full-term successful pregnancy. But a lot of patients, sometimes even given advice by their doctors, you should just try again. Sometimes miscarriages happen, sometimes these things are just bad luck, you should just try again. But here again, I'd like to emphasize that a miscarriage happens for a reason. There is no luck related this occurrence of a miscarriage. Either there is a hormonal imbalance, an immunological factor, something wrong with the ovaries, the uterus, or even your partner's sperm quality. All of these actually are all diagnosable and actually treatable. So the number one advice is that you should not get pregnant, to be immediately on contraceptives, and then seek treatment from a trusted medical professional. What we recommend is that you should find a specialist in the area of miscarriage prevention and treatment. So you want to keep your miscarriages very low, 1 to 2, because these types of miscarriages are very simple in nature. Usually what we, in our history, is that there's only 1 to 2 underlying causes. 1 to 2 underlying causes is easily diagnosable and easily treatable. But for many patients that we deal with, they've already gone to 4 to 6 miscarriages already. And we can immediately know that the underlying cause is quite advanced. There could be multiple causes, 3 to 4 underlying causes. Just because they are just following the doctor's advice to keep trying again. We can't really blame these patients. They also do not know. They are just constantly trying again because they want to build a family. It's very understandable. So the advice here is to don't try if you have a miscarriage. Get treatment from a specialist, and then once you go for a prenatal full systemic checkup, make sure that everything is fine, make sure that there is no hiccup that will happen during the pregnancy. This time then you can have much more confidence to have a full-term pregnancy. No hiccups, no complications. This is what we want, and this is what we can guarantee here at Antai Hospital. This is always our assurance and responsibility to our patients. We want to make sure the pregnancy journey is smooth. So how we do this is that before you get pregnant, get a full systemic diagnosis, get a treatment, be honest about your medical history. Have you had treatment, surgery, induced abortions? Are you on any other medication that might potentially affect your pregnancy? All of these are under our control. And once you have the green light from your doctor, a full-term successful pregnancy can be guaranteed for you and your family. Get in touch with us here at Antai Hospital if you'd like to seek consultation. If you also experience repeated miscarriage with no success, get in touch with us today. We can help you. Leave me a comment down below.